The Injury Research Group does research in 5 main areas. We describe the size and nature of the problem of injuries, look at variations in injury risk, develop evidence about what works to prevent injuries, measure the longer-term consequences of injuries. Lastly, we look at how to get our research findings into practice.
We're interested in working in the area of injury prevention because it's a really important area.
Nobody wants a young child to climb into a bath of scalding water and to have body burns all over. Nobody wants to have an elderly person fall down and then end up having to go into a care home.
Injuries are a really big problem. They're the most common cause of preventable death under the age of 60. In terms of childhood injuries, and every week 1 child under 5 dies in England from an injury at home, 800 get admitted to hospital and 9,000 attend A&E departments. And what's really sad about this is that most of these injuries are preventable.
We've helped to produce different reports at world, European and national levels. The number of deaths and injuries to children over the last 30 years have reduced tremendously.
I think in terms of preventing home injuries in childhood, we've done a series of randomised controlled trials and systematic reviews and meta-analyses, and these have shown that we really can help families to make their homes safer and to reduce injuries in childhood through education and helping families access home safety equipment.
The research that we've done around falls prevention in clinical trials is now being extended to look at the implementation of those programmes in the community in areas of the East Midlands, and we're now seeing a rollout of those programmes across several local authority areas.
I see our work continuing to develop evidence about what works in terms of preventing injuries, but also moving more into looking at how we can get our research findings into practice.
Implementation science is a new and exciting area, and I'm keen to explore that in the future.
The area of injury prevention is still a developing area, but there has been lots of success, certainly within high-income countries. However, there's lots of injuries happening in low-income countries. That's where most of the deaths and injuries are actually happening. So what I'd like to do is see whether some of the successes in the high-income countries could be transferred appropriately to low-income countries.
I'd also like our work to develop more on looking at how we can help patients to recover more quickly and more fully from injuries to reduce the impact on their lives.